Good morning. So this is the audience participation portion of the panel. I have a real limited goal with you this morning, and that is to convince you of the importance of pushing the data let me say the quality improvement effort down to our line staff. There's a little bit of misnomer in the title. It says getting client and staff buy-in, but I'm really going to be focused only on getting line staff buy-in and how important that is. But first, a joke. Right. So some of you may have heard this before. Sorry about that. Those of you who haven't, you're in for a treat. This is the only evaluation joke that I know, so it's fairly appropriate. So a farmer is out tending his flock of sheep, and a red sports car comes rushing up to him. This young man jumps out of the car and says, "If I can tell you exactly the number of sheep you have in your flock, would you give me one?" And the farmer thinks about it for a second. He says, "Okay, I'll go for that." And the young man whips out an iPad and he goes to a GPS site and he scans the area and he does his Excel spreadsheets and he reports back to the farmer. He says, "You have exactly 1,806 animals here on this plot of land." And the farmer thinks about it for a second and he says, "That's right, take one of my animals." And so the young man, looks around close by, picks up one of the animals and starts to bundle it in the car. And the farmer gives kind of a sigh and he says, "If I can tell you exactly what your profession is, will you give me back my animal?" And the young man thinks about it and he says, "Sure, I think that's fair." And he says, "Well, clearly you're an evaluator." And the young man says, "That's right. Well, how did you know? How did you guess that?" He said, "No guessing was required. You showed up here though nobody called you. You gave me an answer I already knew to a question I never asked. And you obviously don't know jack about my business. Now give me back my dog." So this is, sorry for you evaluators out there. I know there's some. Joan, sorry, yeah. You should all have a copy of the monthly PSC activity detail, the caseload at a glance. I wasn't kidding. We are going to go over this. And I intentionally didn't give you an electronic version of this because I want you to feel what it's like to be a PSC working in the mental health field. The interesting thing about coming to a forum like this is that people are at very different levels of functioning in the mental health system. You get the Ron Manderscheids who are working at about the 50,000 foot level, and then you get people like Vanessa Baird or Kiyomi Burchill who are at the 5,000 foot level, and you get your county directors who are at the 500 foot level. You got me at about the 50 foot level. And then you've got your middle level managers, program managers, middle team managers at the 5 foot level. And by the way, I'm using a log scale there because I think that's the difference. I could say 1, 2, 3, 4, 5, 6, but that's not the difference between those positions. And then you got your line staff at about the 6-inch level. They're down in the weeds with the people that we serve. And the point that I want to make is that there is an amazing, tremendous imbalance between who's producing data and who's consuming the data. All of us, as administrators or policy wonks and those kinds of folks, we're all the consumers of the data, and we haven't got a clue as to what it takes to actually produce the data. I mean, intellectually we know it, but we don't really know what that experience is like. And this cartoon actually, I think, addresses, I should have said this is why we fear evaluation. The hate comes after the fear. The hate is based on our fear. And the reason why we fear it is because when you're down at that 6-inch level, you're afraid that it can be used in a punitive way against you. And you don't see the data coming back to you in any useful way. And I'm grateful to all my prior panel participants because I'm building on what they said, is that we got to find some way sort of moving the data into a format that's actually useful. And I think that Debbie and Neil and Karen all gave ways of doing that. I too am envious of Debbie and Eskomberg, so I want to admit that up front. But at MHA, one of the things that I'm going to go through here because I know we're really behind. We've talked about the importance of trying to calibrate, as Neil was saying, the palette of measures and different measures and how those interact with each other. And all of you are probably aware of the recent SAMHSA definition of recovery. And these are the 4 domains of recovery, and I think it's worth going over them. So health, home, purpose, and community. Now, we do good things when it comes to measuring some of these. I think the health part is we're measuring that pretty well, and the home part, I think the FSP data get at that pretty well as well. But purpose, meaningful daily activities, those kinds of things, I'm not sure that we're getting at those. And what I'm trying to say here is that these are, for me, the criteria of any measure that we use. It's not important to me what specific measure that you use. Morse. But what you do need to look at is the measure that I'm using actually capturing these underlying domains? That's really the question that you want to ask yourself. Because for adults anyway, the major goal of our efforts is to help them to recover. And if this is how we are defining recovery, then our measures need to reflect those underlying dimensions. Okay? So what I really want to talk about today is how do we make that transition to helping our staff become consumers of data, because that's where the real quality improvement will take place. I think Debbie addressed this, is like trying to help people to understand how the data can be helpful to them. And the sheet that I gave you is MHA's first initial attempt to do that. Okay, it's like this is the sheet that I will require all of my team leaders once a month to sit down with their staff and go over with each of the with each of the PSCs on their team. And this is really what I call a recovery-oriented registry, to use the term that Karen was talking about. Now, the individual components of this thing are not as important as the concept here. Over on the and the reason why we chose these particular elements